Kristen Moffitt in the Division of Infectious Diseases at Boston Children's Hospital. Good to see you.
Yeah, good to see you too.
So we know that big number still only represents about 9% of total cases, but what could account for such a big jump? And I think more importantly, what should parents take away from that as we think about reopening schools?
Yeah, there are likely a number of reasons for the increase in pediatric cases that we've seen recently, but the most likely reason would be the loosening of restrictions on physical distancing and the re-entry of children into settings where they come into contact with an increased number of people. So this might include camps or athletic practices or some crowded summer activities. The takeaway for this, though, and what this means for school reopenings is that transmission in schools is really largely going to reflect what's going on in the community, which is why the safest approach to getting kids into classrooms starts with control of COVID-19 transmission in the community. And once in the school building, physical distancing and masking to whatever extent can be done feasibly will be critical measures to keep staff and students safe. But it really needs to start in the community.
So you touched on that a little bit here. When we think about reopening, what does success look like? Is it realistic to think that there will be no cases, or should parents instead be looking at, okay, what is the school's plan if a child is diagnosed?
Yeah, so there's no reopening plan that can assure zero risk of cases occurring in schools unless those reopenings are happening in a community that has had sustained zero transmission and everyone in that community is living in a bubble and only interacting with people in that community. So success really needs to be framed as transmission that in the school setting is at least no higher than what it is in the community. And this will really require all these risk mitigation practices that we've been talking about. And then exactly as you suggest, this will really need an organized plan for how to respond to cases in the school. And this has to start with communication to the families, and it should also include plans for quarantine and for testing of those who've been exposed, and it should include plans for excluded students to be able to continue to learn via online learning as well.
So if a parent knows that their child is going to be going back to a school building in September, what should they be doing now to prepare them for that experience?
Yeah, so now is a great time to start talking to kids about how school is going to look a little different than it did when they left it in the spring, but to really emphasize the point that these differences are in place so that they and their friends and their teachers can stay safe. I think another important conversation is to emphasize the importance of staying home from school and staying home completely if you're not feeling well, and really normalizing the fact that there should be a discussion every morning about how they're feeling and about the need for them to be really honest about if they're having a scratchy throat or anything else that would be reason for them to stay home. It's a good time to review hand hygiene and how that should be done and when that should be done, and do as much modeling and practice at home around wearing masks and safely taking off masks and around physical distancing as well.
Good advice, and I think something that so many parents, myself included, have been thinking about all week.
Yeah.
So we appreciate your time. Thank you so much.
Thanks for having me.